right, it's 1:30. Hello, everyone. Thank you for joining us today. We're very excited to host this event today and have Bonjour Parenthood join us here. Um, Let me quickly go over the items that we'll be talking about today. We are here to discuss the postpartum period, how you can build your support system and plan. I'll make some brief introductions on our panelists today. And hopefully at the end of this conversation, you will understand, what to expect in terms of follow-up care, know some common challenges that many patients and parents experience, know when to call for help. And Bonjour Parenthood will talk to us about some unexpected difficulties that many families experience. They'll also discuss different support options that are available to you, including healthcare providers, postpartum doulas, lactation consultants, and even night nannies for those patients who feel that they would prefer that. At the end of this conversation, we hope that you will know how to prioritize your rest and recovery and develop a well thought out postpartum plan. I am Jeanette. I'm the COO at Astor. I recently completed my master's degree at Columbia University Mailman School of Public Health. I have been at Astor since inception, but my proudest accomplishment is giving birth and raising two amazing human beings. On my spare time, you might catch me exercising, cooking, or advocating topics related to female health. Our physicians here today are Dr. Faris Fahmy, Dr. Faris Fahmy and Dr. Rachel Rosner. Let's start with Dr. Fahmy, who's a board-certified physician in family medicine and OBGYN. He has been practicing OBGYN exclusively since 2001. Dr. Fahmy's main interest lies in creating a long-term partnership with patients, empowering them with science-backed knowledge, and tailoring his recommendations for depending on the patient's risk factors, lifestyle needs, and preferences. When Dr. Fahmy is not seeing patients, he enjoys spending time with his two daughters and chasing around his two furry cats. Dr. Rachel Rosner joined our practice in 2022 after completing her OBGYN residency training at Yale Health. She's the mother of two young children, Lily and Hudson, and as a professional working mom, she's well aware of the challenges and difficulties many women experience during the postpartum period. She's committed to listening to her patients' needs, evaluating them with a holistic approach, and providing them with the top-notch care that they deserve. When she is not taking care of patients, Dr. Rosner enjoys being a mother, painting, cooking, and traveling. Next, we have Valerie Boulet and Andrea Brune, both from Bonjour Parenthood. Bonjour Parenthood is a premium postnatal care and support system inspired by European best practices. They help families navigate the transformative journey of parenthood with confidence and serenity. Bonjour Parenthood provides a tailored range of services designed to meet the unique needs of each family. Their packages include a comprehensive 3-phase support over the course of a year, featuring personalized postpartum plan, in-home and virtual assistance, as well as curated resources designed to support new parents and their babies. Drawing from European values of holistic care and community support, the platform blends modern expertise and timeless nurturing practice to empower families in building a healthy, joyful foundation for this new chapter. Now I will turn the microphone over to Dr. Fahmy, who will talk to us about how Astor OBGYN does postpartum care. Dr. Fahmy?
Hello, everyone. Thank you for joining us. And Astor OBGYN, a very important part of the pregnancy is the postpartum period. We feel that it needs to be addressed exactly the way we address during pregnancy. We usually, when after the delivery of the patient, There are a lot of different subjects we cover with the patient that we feel that they might not think of it at the moment. And so we make sure that after the baby's born, we talk about their postpartum care. So that includes how can we personalize the care for that specific situation, whether somebody had a C-section or somebody had a vaginal delivery. The care is a little bit different. And so we usually see patients 2 weeks and 6 weeks after the birth. However, they have access to us 24 hours 7. There are a lot of issues that could come up during their postpartum care, which Dr. Rosner will mention. But we make sure that they understand that it is an important part of our pregnancy care. We always provide our patients with the ACOG book. ACOG stands for American College of Obstetricians and Gynecologists. That's a book that we give to all our patients. And it has a full section on the postpartum period to cover things like exercise, sleeping, breastfeeding, child care, sexual health, urinary issues that could come up, or any kind of vaginal floor issues. We like to give that book because we feel it's a good scientific source for the patient, but it's written in an easy to understand way. And it's backed by ACOG itself. We became board certified through them. So a lot of the things that they say are scientifically backed up. And we hope that this book would help our patients find the best source of information. As I said, our access to our patients, or patients' access to us is 24 hours 7. And so they could call us at any time, night or day. We're open here 6 days a week. We're only closed on Sunday, but we're open Saturdays. We have evening hours to make sure that our patients could see us in any of those days. We feel that supporting our patients in the postpartum period is important because there are a lot of expectations on the mom, and there's a lot of expectations from the mom on herself. We feel that these expectations tend to put a lot of burden on the mom, on the spouse, on everybody around them. And we want to make sure that we discuss them with our patients at length. So Dr. Rosner will talk about, some of the issues that can come up.
So at every postpartum visit, as well as the visits during pregnancy, we talk about the patient's specific goals and how they would like their birth and their postpartum experience to look. We very much try to keep the patient, her family, her partner, and the other people involved in her care at the center of every visit. And in talking about the topics that are most important to the patient, we also always touch on several very foundational aspects of postpartum care, which include the physical changes, which is what I think is very front of mind for a lot of new moms. What's my body going to look like? How's it going to function? What's going to be different? And also talking about the discomforts that are associated with those changes, and how the patient and her care team can kind of work together to address those discomforts and to make that transition into postpartum smooth and easy and comfortable for everyone involved. Very important, of course, is bowel and bladder function. And we address this during pregnancy, for those before pregnancy visits, but especially postpartum. That is a very important topic. And of course, we want to keep our patients healthy in all aspects. And so addressing the dietary needs, as well as the way that their body changes and how they might require additional support for the pelvic floor musculature, pelvic floor physical therapy, what movement looks like postpartum, and how they can kind of find a new routine that includes their baby and their partner is a really great way to kind of come up with a plan and structure and get patients excited about these new changes, which can feel scary, but is kind of their new normal. Of course, one of the first things I like to talk about at the visit is how mom is feeling emotionally. It's a really big topic, and I'm so glad that maternal mental health, especially postpartum maternal mental health, is becoming a much bigger topic mainstream and on social media. It's a really important topic, I think, to all moms, because even though it's the best, most exciting time of your life, sometimes sad feelings and unexpected low points can come around. And that's definitely where Dr. Fahmy and I and the whole care team come into play in supporting you and kind of making sure the patient understands the importance of talking about how they feel and letting other people know what their needs are so that we can support them as best as possible. Right into that emotional challenge is like definitely fatigue and sleep deprivation. This is huge, and it's not if it will happen, but when. And I think one of the best things that a patient can do is come up with a plan for addressing what people and services she can lean on and provide her support for those late night feedings, for those late nights that I think we all get a text from a friend who's like, my baby's fussy, not sleeping through the night. We all need that support to lean on. And while Dr. Fahmy and I are definitely here for those patients, services that Bonjour Parenthood offers, such as those night nannies, can provide that comfort and support that I think a lot of patients feel like they really want to lean on, and that's a great thing. Lastly, the new family dynamics, what that looks like and kind of what your village looks like postpartum is going to be different for every patient. And we definitely talk about what that looks like and the different options that patients have for support, and not just medical from Dr. Fahmy and I's perspective, but also people in their life, family visiting, pediatricians. We give advice on all these things.
Good. And then we'll get into the other subject that is important, the postpartum period, which is when would you call your doctor? When would be the symptoms that you would feel? You say, I need to reach out to the provider. We'll just go through several topics. One is infection, whether somebody had a cesarean section or a vaginal delivery. An infection, when it happens in these areas, the most important thing is fever. Fever 100.4 or more is how we diagnose fever. And depending on the location where the infection is, whether it's a C-section, in that case, the cut on the actual C-section will turn red, hot, swollen. It swells up, sometimes even it opens up, and there will be a yellow bad odor discharge coming out of it. Yellowish green, because sometimes people can have yellow clear. So I would say yellowish green, but mainly just it looks inflamed, it's painful, and it becomes very obvious. Same thing if somebody had stitches in the vaginal area, that area would swell more than usual. Of course, after the delivery, the area swells, but within a day or two, the swelling tends to subside. But we're saying a few days after, especially after day 3 or 4, from 3 to 7 days is usually when infection shows up again in the perineal or vaginal area. Suddenly it will turn red, hot, swollen, painful, and the cut might open up. And again, the yellow bad odor discharge, yellow-green discharge will come out. If it's an infection in the uterus, then the uterus itself, normally the uterus, after birth, you would feel it right behind your navel, right behind your belly button, and it's usually firm. Of course, if somebody had a C-section, it'll be a little bit tender, but after a vaginal delivery, it shouldn't be tender. But then it shrinks down within the next few weeks. If the uterus is infected, then when you press, it really hurts, and people say that they have more bleeding than usual, and the bleeding has a very bad odor. But again, fever is one of the most important things that will show up, and definitely you need to call your provider when that happens. Nausea and vomiting, it could happen for so many different reasons. The one that really would concern us the most is if somebody's developing preeclampsia. Preeclampsia usually happens before while the patient is pregnant, but sometimes can happen in the postpartum period. The blood pressure will go up, but people wouldn't feel that. What they would feel is headaches, blurring of vision, they get nauseous, they're throwing up, they're not feeling well. Again, the first thing you want to do is call your provider so you can get your blood pressure checked and make sure that there's nothing else going on. Pain levels. After a cesarean section or if somebody has stitches, and the vagina, if the baby makes a cut, it's true we do expect pain, but you should go home with pain medication. If the pain medication is not working, this is when you need to call your doctor, especially if the pain gets worse and Motrin is not helping, or if you had a C-section, then usually get morphine medication. It could be either Percocet or Dilaudid. You're still taking it and it's not working. The pain is getting worse. Please reach to your provider. When it comes to bleeding after birth, we call this, we look at the bleeding as either expected, which is something like a heavy period in the first couple of weeks, nothing more than that, but then eventually that discharge subsides. Bright red blood with large amounts of blood clots coming out is something that I would definitely reach out to my provider to see what they think. A lot of times it's just a matter of a few blood clots that come out, but sometimes it could be more than that. This is where your provider will examine you, see if you need an ultrasound, see if there's any a little bit of what we call retained product of conception, or a little bit of a membrane of the placenta is still left in there, and that's very easy to take care of. The discharge and the redness, like we mentioned, the discharge is normal after the baby's born, but the area shouldn't be, it shouldn't have like a really bad odor. It shouldn't be very heavy with clots, but we do expect discharge. I would say one of the most under looked at area is the mental well-being of our patients. It's very important to understand that it is an important part. It could last up to 1 year of the mental health of our patients. Why we look at it 1 year? Because during that time, the patient really is, our patients are not seeing their physicians on a regular basis. They may have a toddler at home while taking care of the baby. They're not getting their sleep. So at one point, they would start to feel either helpless or just unable to cope. That could also come with lack of sleep, lack of support, and we want to make sure that all our patients are aware that this is something that there is help for, there is treatment for, and definitely reaching out to your provider is very important for that. So those are the warning signs and symptoms that we mentioned. Now we're going to go back to Jeanette.
Well, now we pass it over to Bonjour Parenthood for Andrea and Valerie, who will talk to us about Bonjour Parenthood.
Yes. Thank you so much, Dr. Femi and Dr. Rosner, for those important reminders. You showed a lot of those postpartum challenges. They are very, very common, but as you said, a lot of them are underestimated or overlooked. What we're seeing in our practice in providing in-home postpartum care to families is that even, there is a difficulty for some moms to just rest, right? So rest is crucial for both physical and mental health during the postpartum period. But new moms often feel pressured to do too much too early, and that is detrimental to their recovery. It can come from social peer pressure or even their own expectations that makes us feel like we need to bounce back quickly, or maybe from social media images that we might see where we feel like maybe as new moms, we need to be able to go back to our life as if nothing happened. The reality is that rest is crucial in the immediate postpartum period, but even later on. And in those first few days, there's a novelty. It can be, difficult to rest, but just keep in mind you're in it for the long run, the long run, and the fatigue is going to build up over time. So it's absolutely crucial that you focus very early on that recovery. Even though physically you might not see, there's still an internal wound in your uterus where the placenta was attached that it needs to heal. And it's not because you can't see it that it's not there and it doesn't need care. So, our recommendation really around rest is surround yourself with supportive friends or family members or even professionals like postpartum doulas, newborn care specialists, night nannies as well. We'll go into the details of all of those to help protect your time to rest. So you can to contract everything else and just focus only on resting and bonding with your newborn. The second thing that we often see being a little too often overlooked is postpartum nutrition and hydration. So the one message that we want to pass on here is like, don't overlook your own needs in favor of your baby's. Your recovery and your energy levels are directly tied to your ability to care for your baby. So having proper health, healthy nutrition at as much regular time as possible, proper hydration is going to be vital for your well-being and your recovery. If breastfeeding, nutrition and water intake is also directly linked to your milk supply, so especially important. So here also a few tips from us are, if you can plan meals ahead as much as possible during the last trimester of pregnancy, by, either it's meal prep and freezing or buying and freezing, or organizing a meal train, having your friends or family members organize a meal train where every day there is someone dropping us food at your door, or if it's available to you, subscribing to a delivery service, that is ensuring that you're feeding yourself and you're feeding yourself with nourishing foods that is supportive to your recovery. Hydrate regularly. It can be easy to forget when we're busy or when we're not trapped or breastfeeding. But again, especially important for the recovery. Those are all things that if planned ahead, is going to free so much of your mental space and your time to focus mostly on resting and bonding with your baby. The third point that we want to make is about communicating with your partner and organizing the household logistics beforehand. Who is have a clean and an honest conversation with your partner before the birth, because it's really difficult to have constructive conversations when we're sleep deprived, hungry, thirsty, and overall on the roller coaster of our hormones. That's not usually when the most thoughtful conversations are happening. So really, it's very important to have as much conversation beforehand. What does that mean? What are we talking about? It can be the logistics of the house, who is going to be doing what. And we're really much into the details, meaning who's taking the trash out, who's taking care of the dog, feeding the dog, walking out the dog, what's going to be the sleeping arrangements. Are we all going to sleep in the same room? Is the partner has to go back to work, maybe a separate room? Who's going to be doing most of the baby care, etc., etc. It sounds boring, but very important to do it beforehand, because it's, again, not in the heat and moment where you're sleep deprived and hungry and tired that you're going to have those constructive conversations. Discussing as well what we find out and what we highly recommend every other client is have an honest conversation about your values and what type of parents you want to be. What kind of values do you want to pass on to your children? And it's very easy once our child is born and we're bombarded by images on social media or friends or, all well-intentioned, but there's so much information out there. It's very difficult sometimes to know what to do and how to do it. So always coming back to what's important for you, what are your values as new parents, are going to be kind of your lighthouse, your guide through all this. So very, very important as well. What we always recommend is having those conversations as much as possible beforehand. And then once the baby's born and you're in the heat of it, navigating changes is difficult for everyone. Remember, you're a team. So it's very much about supporting each other, checking in with each other. How are you doing? Do you need some time? organizing me time, or for each of you, or time just for the two of you to talk about something else. And adjust your expectations, right? Nothing is exactly how you plan it in your head. So be flexible. No, it's not going to be easy every day. There are ups and downs, but it's wonderful to have professionals like Dr. Femi and Dr. Rosner that hold space to share all those challenges, and that offer that stage to be able to express yourself. And then the last thing is really when you have out of the first few weeks, and if when you're planning to returning to work, things are going to change again in terms of organization. So make sure that's also discussed beforehand, so that the mental load and the logistics of the house and the baby child care is fairly distributed. So who can help? There are different type of providers, right? Your healthcare providers like Dr. Femi and Dr. Rosner are your go-to for any medical questions. Your pediatrician is going to be your go-to for any medical questions related to your child. Use them as much as possible. It's wonderful that you have 24/7 access for emergency. I believe there is no questions that should stay unanswered. Like we said, it's very easy to overlook its own when billing when taking care of a newborn, but it's just as important that you're being supported. So there are 3 different types in terms of postpartum support help. There's 3 types. The most common one that we hear the most probably is the night nanny or night nurse. Just for clarification, most of them are not nurses, meaning they don't have a nursing degree. So that's kind of misleading. So let's call them night nanny for now. So night nanny, usually it's reference-based. You can hear it from a friend or a Facebook group, mom group. Don't know that the experience varies drastically from one person or another because there is not real training or certification. So it's very much based on the one person experience, right? That person is going to take care of your baby nighttime to allow you to rest and sleep. Depending on who you're working with, this person might be able to additionally offer some tips or support with feedings, et cetera, but it's very much based on who you're working with. So it's very important in any case, like anybody that you hire in your own house, that you do your due diligence, ask for referrals, any certification it might be, CPR trained, if there are, criminal background check, whatever it is. So that's only night support. Then there are newborn care specialists or baby nurses, sometimes we hear as well. They focus on the newborn as well. That can be daytime or nighttime. There are some certifications that are now we're kind of seeing. So you can always ask if they have some type of certifications. Here it's really much going to be also about the newborn care. Focusing on the baby only. And then we have the postpartum doulas. Postpartum doulas are focused on the well-being of the mother and the baby. And that's the big difference here. The mother is also being taken care of, right? So, and that the goal is to ensure that the mother can rest and recover while they're also helping with baby care. So they'll make sure that mom is fed and hydrated, that she's going to do a little bit of house chores around the house, and offer additional skills. Sometimes some of them are trained to do the rebozo, the belly binding, massages for infants or mom. Again, it's very person to person, but they all own a postpartum doula certification, and they are a very well-known certification agency out there that have been doing that for a very long time now. So make sure to check those. And that can be support that they offer daytime or nighttime. What we offer at Bonjour Parenthood is we go even the extra mile. We work with postpartum doulas in those first few days after mom and baby come home from the hospital. But we go the extra mile because we're really much, our approach is very much mother-centered, family-oriented. And we include partners, siblings, we're already working on the whole family dynamic, right? We also help partners, making sure they're also okay. It's a big transition for them as well, right? And they're also exposed to potentially PMADs, so the perinatal mood and anxiety disorders. That includes postpartum depression. So it's very important that we also pay attention to them. We also support them in finding their place, their role, especially when mom is breastfeeding. It can be a little tricky. So it's really the whole family dynamics. These are at the core of what we do here. So those, and then lactation specialists, we're going to talk a little bit more about breastfeeding specifically, which is a very common challenge, probably one of the biggest. But just the last point we want to say about any of those postpartum support that you can hire, whether a postpartum doula, night nanny, or a newborn care specialist. It's very important that you do your due diligence and you make sure to have an interview with them beforehand. Those people are going to be in your intimacy at the most vulnerable time of your life, one of the most vulnerable times of your life. It's very important you make sure that you have you're feeling comfortable with that person being around your house. Make sure they're asked for any certification, any referral, to run a background check, are they CPR trained for infants, et cetera, et cetera. So if something feels off, maybe it's not a right fit for you, keep looking. Okay.
So as very well said here on the slide, it takes a village. At the end of the call, we will also send you a postpartum plan that we crafted and that we actually share with all of our clients and that we prepare with them actually. Because as Valerie outlined, there's so many topics that we're just not prepare ourselves during pregnancy. Again, everything is focused on the mom during the pregnancy, and then once the baby is born, the shift just turns to the baby, and it can be very overwhelming and isolating. So again, that postpartum plan is something that we encourage every single mom and family out there to properly prepare. Again, what Valerie mentioned, who's going to take care of the household logistics? What is the dynamic going to be with your partner? Who's going to do the groceries? What are you going to do from a meal perspective? Are you going to have your fridge stocked up for the first few weeks? And we're focusing here on the first few days, first few weeks postpartum. But as Dr. Fanny said, postpartum really lasts up to a year. According to from some French specialists, it might last up till 3 years after childbirth. So it's really about making sure that you're ready and that if you have questions, you know who to reach out to. The next topic we can talk about is breastfeeding.
Yeah, we wanted to go back quickly, Jeanette, if that's okay, on breastfeeding, because that is probably we sleep, like sleep and breastfeeding for those who chose to breastfeed is probably one of the biggest concern and challenges that we're seeing. So we wanna remind a few things here. Breastfeeding is natural, but it's not always easy. It's a learned skill for both mom and baby. And for many moms, it's actually quite challenging. It's both mother and baby needs time to practice and adjust to the process. So patience and support are absolutely key here if breastfeeding is something you feel strongly about. So it's important that, it might take time and try to plan surrounding yourself with the people that are going to help you. So who's that be? Ensure you can request a visit of a lactation consultant at the hospital, because at the onset of breastfeeding, those first 24, 48 hours are really crucial, and there are support in the hospitals. Just need to make sure to request it. Maybe consider booking in advance a lactation consultant to come to your house. So the type of professional you want to look for are called IBCLC, International Board Certified Lactation Consultant. And it's great if you can plan it ahead so that you can have a visit in the first few days you're back home. Their expertise will provide additional support and troubleshooting if you're encountering any issue. Also, be realistic. Like, it's important to have realistic expectations. We found that many mothers are actually surprised about how what they envision is not aligned with the reality of what breastfeeding requires. So educating yourself about, the process and milk production and all that, it can help already align those expectations better. and prepare you for the reality. But ultimately, our main message here is like, take a deep breath, right? It's okay also if it doesn't work out. You've tried, it doesn't work, or it's too much, or whatever the reason is, it's not for everyone, and that's okay. So if it becomes too difficult and doesn't support your well-being, really here, our key message, as you've heard probably me talk about over the last 10 minutes, is all about you, your rest, your recovery, your well-being, because that's how you're going to best be able to take care of your baby. It's okay to choose an alternative feeding method. You're not failing, you're not a bad mom because you've decided to feed your baby differently. Ultimately, what's most important is the family well-being, right? So if there is an alternative method of feeding that works better for you and your family and your baby overall, that's your goal. That's what you want to go with. So that's really one thing we really wanted to say about breastfeeding, because we do see this to be very challenging for mothers, and often can be very physically and mentally difficult.
I think now we can go over, let everybody know that they can post questions. At the bottom of your screen, you have the activities, and you can go to the question and answers, and you can post your questions. Nobody can see these questions other than us as presenters. So you can go ahead and type any questions you have for Valerie or Andrea, or for Dr. Fahmy and Dr. Rosner. We're here to answer any questions.
Actually saw a few people raising their hands while we were talking.
Oh. Oh yeah, I do see some raised hands. So if you wouldn't mind typing your question, and then we can read them.
So to ask the questions, yes, you got to go to the bottom right, the activities. I think it's a signal, like a little symbol with like a triangle, square, and circle, and then select Q&A, and that's where you can ask your questions. Jeanette or Dr. Fahmy Rosner, is there also one thing that we know as European, and that we also try to raise awareness a lot with our clients, is around pelvic floor rehabilitation. Is that something that you can quickly talk about maybe as well? Maybe
Yes. So pelvic floor rehab is a really amazing resource, and I believe and have heard from many patients that they have this problem that is deeply personal, and you might not be able to tell when looking at them, but it affects their daily life often multiple times a day. And they either don't know that pelvic floor rehab exists or how it can help them. And I will say that there are some really amazing practitioners here in Manhattan and in New York, great in the New York City area. And I'm always really happy to match patients with different providers who specialize in pelvic floor rehabilitation that can address their specific concerns, because it's not like your typical rehab. Pelvic floor physical therapists are highly trained, very educated individuals who specialize and are really passionate about treating things like weakness of the pelvic floor, bladder dysfunction, loss of urine, with laughing, coughing, sneezing, and helping also with things like scar massage after a C-section to kind of help improve the look and the feel and the functionality of the skin overlying the scar, as well as helping sometimes with those lower extremity symptoms, or just kind of the general weakness of the core that is seen very commonly in the postpartum period. I think what a lot of patients say is everyone should go. And I think that Dr. Fahmy and I definitely support all patients in that option to go and encourage them, and are happy to connect them with specialists in the area.
So we see someone raise their hand. Should we let them know? Because I feel like the Q&A is not as easy as it looks.
Yes, yeah. So maybe we can just Andrea and Valerie, why don't you ask some questions that people normally have, and maybe Dr. Fahmy and Dr. Rosner can answer some of those questions.
Mhm. Okay, hold on, yeah. Okay, what type of questions? I mean, a lot of questions that we usually hear are around surrounding baby care and sleeping and all that. So, I think what you went over the warning signs, things that require immediate, calling you immediately, calling the healthcare provider immediately. What are, I guess, what are the normal discomfort that women will experience commonly in the first few days? And at what point does it become not normal anymore?
I mean, I think it varies from one person to the other. Usually, if somebody's having had a cesarean section or a vaginal delivery and they have stitches in there, usually the medication that you take home, which is Advil or Motrin, or the Percocet, should be enough for you to be able to function. And I think the bottom line is, are you able to walk around? Are you able to urinate without any issues? Are you able to have a bowel movement without an issue? Are you able to take care of your baby? And if you have any toddlers at home, so it varies from one person to the other. And I think the big factor is if you can't, if you feel, no, this is too painful, I cannot get out of bed, or I cannot be running out of my after my toddler, and you're just saying, no, I need help. And there are so many different ways of finding help, whether it's just being that you're exhausted and not getting the sleep, and this is one of the reasons why you're not healing well, or if there are other factors involved, like an infection that is brewing in the area, and this is why it's just becoming more disabling. So I would, again, that would be my concern, is, are you able to function or not function? With the mental health, I just want to remind everybody that it can happen to any person. Definitely people who have a history of prior depression or anxiety or any kind of mental illness, they tend to be the highest, the ones that are more risk, but actually could hit anybody. And people don't choose to feel depressed. They don't choose to feel sad. And so we know that this is not something that you could control. And we have the resources to help you, whether you might need a social worker, you might need a psychologist, a psychiatrist, medications, increasing your medication or changing medications. All these resources are there for our patients to help, for us to help them with it, and they shouldn't be left alone with it.
One thing, I'm sorry, one thing that we haven't, I think, discussed much about is sometimes breast engorgement and signs of mastitis. Can you talk a little bit about that?
Sure. So I can definitely talk about that. I have 2 years personal experience breastfeeding my children, and even when you do everything right, and I think you guys definitely touched on this as well, it doesn't always go the way you imagined. And so a lot of times patients can become very concerned when they feel lumps or masses, or even redness. There can also be an abscess that forms if an infection is left too long. And so there's definitely certain practices with regard to breastfeeding, using pumps, and how you're kind of taking care of the breast, which is very important and definitely something we talk about at visits, that can all contribute to a healthy breastfeeding journey and not. And so if you're feeling masses, redness, severe pain, like Jeanette mentioned, kind of like engorgement, it's important to understand and to talk to your doctor about concerns. If it's just like, are you emptying the breast effectively? How's the latch? And also what is normal with regard to length of time breastfeeding, and kind of that overall experience. But there's also things called like clogged ducts, which I think everyone talks about and kind of drives a lot of breastfeeding women crazy. And there's some actually newer, very good evidence on the management of those kind of breast concerns that is a little bit different than what has been historically used, but is helping a lot of women.
One other question that we have is, how do you know if you're experiencing postpartum depression or anxiety? What are the signs? Because everybody's going to be tired, everybody's going to be a little on edge. What are the actual signs that could require to check in with your healthcare provider on those?
Yeah.
I think it's a topic that we both could talk a lot about and feel really passionately about. And I think one of the big strengths of our practice is that we get to know our patients so well. And so sometimes they come to a postpartum visit, and I know I feel this way, and I'm sure you do too. You take one look and you're like, that's not the woman that I provided care for, and something's different. Sometimes it's a patient reporting that they cry a lot more often, and it's not a cry. It's an emotion that just takes over. A lot of women say to me, I know that I'm so happy and I wanted this baby so badly, but I cry. And so understanding, are you crying because you have a lot of emotion, or are you crying because you have feelings that are not normal? For example, intrusive thoughts, or like you're so exhausted, but when you close your eyes, you can't sleep. Okay. This is something that affects a lot of women and is not talked about nearly enough. And so things like that, or feelings like my baby doesn't like me, I'm not a good mother, but the concern that maybe your family or your baby would be better off without you. These are really severe warning signs. And if women are having these thoughts percolating, it can lead to a sense of like worthlessness and a very negative thought pattern. And so these are some of the quieter warning signs that usually the woman's partners and family can kind of pick up on, but it's hard to really put your finger on. So if you or if someone you know is experiencing these symptoms, definitely say, hey, let's talk to your doctor and get us involved, because we can definitely help.
Right. And we can definitely provide a lot of support for our patients. All they have to do is just reach out to us, and we will take care of everything afterwards.
It's great to emphasize. It's actually also something that we share with our clients, and we also share with them that it's not only mothers that can experience PMADs, it's also their partners. So we want, whenever we talk with our clients, we really want to emphasize the fact that a partner should be aware as well of the warning signs that you mentioned, and also be aware that it could happen to him or her. Again, it's not something that should be a stigma. You talked about it. Help is available. It's simple things that can be put in place most of the time. We mentioned lack of sleep, which is a big trigger in PMADs. Obviously, there's other ones that you mentioned, but fatigue is something that can more easily be addressed, whether it's through rearranging sleeping shifts at home with your partner, making sure that you, for example, take turns during the nights, or there's one parent that takes care of the baby the entire night and the other parent the next day. So it's easy things that you implement. Other than that is calling for external help, whether it's a family member, a friend, or external services like what we offer with postpartum, with full parenthood, whether it's a postpartum doula that you want, who is going to offer more holistic care, or if you just want a night nanny, for every now and then, a few nights per week, which is also something that we can offer. So yeah, it's really making sure that I'm taking it back actually to the postpartum plan, but making sure that you know what you're stepping your feet into. Postpartum is a vast domain life after childbirth, and it lasts a long time. So what can happen in the first week may not happen later in the postpartum months. So just be sure that you're aware and that you know who to reach out to whenever there's an issue. You're not alone in this beautiful journey that has ups and downs. Yeah.
Yeah, and really, we strongly believe that partners are the best. Also, can be the first person to notice something is wrong. So it's important that we for partners to check in with each other. And the onset of symptoms of postpartum depression doesn't necessarily happen in the first few weeks. It can happen anytime in the first year, right? When the fatigue is setting in, and it's you're just not catching up on sleep, or you're just not catching up, or you don't feel like yourself after 6 weeks when you thought, after. That's actually a question I have for you, Dr. Femi and Rosner. After is how long can you expect? When can we expect to look like we looked before, right? Or feel in our body like we felt before. But yes, those symptoms of the postpartum depression can happen within the first year. So it's important to remain alert about this, and also, like we've said many times, protect your rest and your recovery. So back to you, Dr. Femi and Rosner. What physically, when can a woman expect to feel like herself again? And does it happen?
Yeah, I think that's very important. It's a very important question, because on the one hand, from the physician or the medical point of view, there are a lot of hormonal changes. Like, for example, sometimes people retain some water after birth. Some people were had a surgery. They may have received a lot of intravenous fluids that makes them swell. I would say it's more of the expectation that I would be worried about from our moms. So their expectation should, it's more focusing on making sure that they get their rest, and eventually things will kick in place once you're able to get 8 out of 24 hours. If you get 8 hours of sleep per 24 hours, including naps, it will just make a huge difference in how you even feel about yourself. Back in the days when we were residents and we did 36 hours and we're just up all the time, we just felt miserable all the time. We didn't feel anything good about ourselves, period. And imagine, for a whole year where you have a newborn, and if you have toddlers running around and they alternate when they get sick, one gets sick and they're up all night. A week later, the other one gets sick and nobody's getting to rest. So the point of, how do you, when do you expect it for yourself to feel better? I think once you're able to get into a rhythm with your baby and the toddlers and your spouse, once that rhythm kicks in, which takes a long time, but once you're able to do that, then I think you're going to start feeling better about yourself, as opposed to trying to look at how much you weigh or what your dress size. Women who are breastfeeding, of course, their breast size is bigger, so they shouldn't be looking at a breast size. They would more be focused on, wearing a bra that matches their breast size, so it doesn't put too much pressure. And so eventually things will get better, and they'll be able to go and exercise and do everything that they did before once they're achieved rhythm. Some people achieve the rhythm in 1 or 2 months. Sometimes it takes them a whole year. And you shouldn't expect anything out of yourself. You shouldn't say, well, in 6 months, this is what's supposed to happen. Because God knows what your baby's going to do to you at 6 months.
Yes.
And, they could pull a fast one on you anytime.
Yep. And they will.
Right. And they will.
That's very
So
true.
this is why all of us have been stressing on the rest part, because we feel this is how, this is where everything starts, is getting your 8 hours out of 24 hours, or eight hours of sleep per 24 hours as your minimum. Sometimes it could be even more. So I'm sure you've heard the advice of, if your baby's sleeping, go to sleep. That's the best sign.
It really is. And what we like to tell our clients as well is embrace the chaos, because it's going to be chaotic for a couple of weeks or even months, depending. There's no pressure again here. Your house may look messy. It's not the time to clean it. Just take care of that baby. The time goes by so fast anyways. You'll blink and your baby will already be a couple of months old. So really set that aside for later. If really you need your house to be cleaned, you can always ask for someone external to help you. I think that's important to know.
But baby registry, what we always recommend as well is, baby registry are great, and we love to have, all those cute onesies and etc. But actually, what might be most useful to put you on your registry is extra hours of house cleaning, if that's what's important to you, or meal delivery, or postpartum doula hours. Those are really what's going to help you most in the postpartum period, because that's what's going to protect your rest. And you are going to be able to implement that rest when your baby rests, right? Or sleep when the baby sleeps, which we hear a lot of moms say, how am I supposed to do that when the baby sleeps is when I finally have time to shower and eat and clean my house and do my laundry. Well, that's the point. If you organize yourself and you have a solid postpartum plan beforehand to manage all of this, then you will be able to sleep when your baby sleeps, and that should be your ultimate goal, because that's what's going to support your physical and mental well-being, right? So I think that's our main key message here. There is a way to sleep when your baby sleeps, and you should.
And so you share with everybody, we're going to share with everybody Bonjour Parenthood's postpartum plan. And we'll also post online this webinar so that people can come back and refer to it and watch this later on as well. For those who join us today, thank you. And for those of you who will be watching this later on, thank you also.
Thank you very much.
Very much.
Well,
Bye.
And
wonderful day. Bye-bye.
bye.